Evelyn Phung. My presentation is about ovarian cancer. And I did this presentation to help aware women and everyone about the causes, the treatments, and their symptoms and other information. According to the American Cancer Society, statistics says that ovarian cancer ranks fifth in cancer death among women, accounting more deaths than any other cancer of the female reproduction system. First of all, let's learn about what is ovarian cancer. It starts in the ovaries, and it's where the ovaries produces the eggs and female hormones. The eggs travel through the fallopian tube to the uterus, and then it becomes a fetus. There are one ovary in each side of the uterus. As you see in the slide, there's a cancer right here on one of the ovaries. It is undetected until it spreads to the pelvis or the abdomen. There are three main cells. One of them is called epithelium, where it starts the covering of the outer surface. According to the Mayo Clinic, 90% of them are epithelial. And another resource from National Ovarian Cancer Coalition said most of these epithelial are benign, meaning non-cancerous. The next is called germ cells. The germ cells is where it produces eggs. National Ovarian Cancer Coalition says that 90% of them can be cured. Lastly is called stromal cells, where it is in the structural tissue cells that hold the ovaries together. Next, let's learn about the symptoms. Most women experience bloating, pelvic pain, abdominal pain. They also feel trouble eating or feeling full quickly. And also, they have a urinating problem. They have to urinate often. Now, there are 4 stages in ovarian cancer. In stage 1, cancer is within the ovaries or the fallopian tubes. American Cancer Society said that if it's found and treated and before it spreads outside the ovary, there's a 92% of survival rate. In stage 2, cancer is either in both the ovaries or in the fallopian tube. It is spread on other organs such as the uterus or the bladder. And then in stage 3 is where it's spread to the lymph nodes and the back of the abdomen. Lastly, in stage 4 is the most advanced stage. It is spread through the spleen, the liver, the lungs, and outside the cavity. American Cancer Society says that 17% chance the patient will survive. Next, there are treatments and preventions for this. One of them is biopsy tests, where women test if they have ovarian, and doctor recommends women to have an annually pap smear, such as this. It's a procedure where it only checks in the cervix, the uterus, or the vagina. Afterwards, they go through surgery, where many doctors attempt to remove all visible tumors. Afterwards, they go through chemotherapy, which is a long process. They try to kill any cancer cell remaining after surgery. This ovarian cancer can be recurring. According to this one article called Treatment, 70% of patients will have recurrence. They said that women who have experienced breast cancer or have family history of breast cancer, they're most likely to have ovarian cancer. This is what usually chemotherapy. You have to go through that. Overall, I hope women know about more information about ovarian cancer and spread the awareness. I hope this presentation broadcasts you to everyone, and thank you very much. Do you guys have any questions?
What are the other causes of ovarian cancer?
Ovarian cancer usually targets older women around 50 to 60, and they're mostly there's not really a cause yet, but most of them are through genetics, like I said about breast cancer. Any other questions?
Do you know anyone that has ovarian cancer?
Yes. One of my family member, my mom, she experienced ovarian cancer, and right now she's going through chemotherapy. It's a really long process. She has to go through all these medications. So I hope she feels better.
I hope that too.
Thank you very much.